Dr. Ken Landau. Thanks for watching. Let's talk about the Narcissistic Personality Disorder. Well, it's a personality disorder, has a long-term pattern of exaggerated feelings of self-importance and excessive need for admiration, lack of empathy toward others, spend too much time thinking about achieving power or success, too much time thinking about personal appearance, a distorted sense of personal superiority. There's grandiosity. People take advantage of other individuals. They're overly confident, overly ambitious. These people have psychological inability to tolerate either disagreement or contradiction or criticism. Difficult to work with these individuals. They can't cooperate with other individuals. Some of these people are very highly successful. They can express the narcissistic traits, but it doesn't really become a personality disorder until the traits become inflexible and maladaptive and persistent, and they cause significant functional impairment or subjective distress in the way they interact with their peers. Well, there's long been debate about the diagnosis itself, and given the limited amount of research and the differences in the way we diagnose the condition, it was suggested that the diagnosis ought to be discontinued from the Diagnostic and Statistical Manual. That's the American Psychiatric Association Bible for diagnosing and defining different psychiatric disorders. It's what's the difference between normal behavior and pathological narcissism? What are the central features? What are the peripheral features of the condition? What are the descriptions of grandiose behavior? We have to take into consideration some of the cultural phenomenon and where a person lives and the kind of people a person interacts with. So is it a distinct personality disorder, or is it just really sort of part of something else? Well, the American Psychiatric Association labels it a cluster B personality disorder. That's together with the antisocial personality disorder, histrionic personality disorder, borderline personality disorder, and of course the narcissistic personality disorder. These are people who are overly emotional, they're unpredictable in their behavior, there's intense drama about these individuals. The condition was first described by a psychoanalyst way back in 1925, Dr. Walder. The term narcissistic personality disorder didn't even come into being until Heinz Kohut labeled the condition as such in 1968. Epidemiology of the condition, well, it begins by early adulthood, occurs across a broad range of situations. It was studied in about 30,000 individuals in a national government study, and they found that the incidence of narcissistic personality disorder was about 6.5%. In men, it was about 8%. Women, it was about 5%. In first-year medical students, it was about 17%. And it seems to be relatively stable over the period of the past 30 years. Seems to be more common in men than in women, more common in younger individuals than older individuals. Tends to moderate over time for many individuals. Not diagnosed in childhood, because in children and adolescents, although they can have the traits of narcissism, there really isn't any defined definition. So the megalomania that children typically exhibit, that's thought to be a stage of growth and not really a psychiatric disorder in and of itself. That comes later. Now, is there any racial proclivity of the condition? Some people say no, other people say, well, the incidence is slightly greater in both black and Hispanic women than in other individuals. Now, outside the United States, the World Health Organization does not recognize the narcissistic personality disorder as a separate diagnostic entity. Here in the United States, we have 10 personality disorders. The World Health Organization in the International Classification of Diseases recognizes only 8 personality disorders. The narcissistic personality disorder worldwide would fall into eccentric personalities or impulsive personalities or immature personalities, passive-aggressive individuals, people with psychoneurotic tendencies. their onset of the condition tends to be somewhere in the early to the mid-20s. It can worsen in middle or old age, or it could get better, but it tends to get worse in some individuals as there's a decrease in the physical attractiveness of the individual and the onset of physical infirmities, because these individuals not only are vain, but they feel they're intellectually and socially superior to everyone else. The cause, we don't know. Seems to be genetic in some individuals because there's a family history oftentimes. And if we look at identical twins, it seems to be more common than in the general population. Seems that it might be in part due to the environment acting on the genes. So a developmental experience, when a person has negative experiences as a childhood, maybe a child rejected as a child, or has an unempathetic or a distant mother, child has a fragile ego during childhood. Maybe it has something to do with the development of grandiose behavior, grandiose self-image. Maybe it's in response to some emotional pain. Maybe the child experiences unusual amount of praise for everyday ordinary activities, and maybe that causes a problem that later manifests itself as a narcissistic personality disorder. Some people claim that it's due to impaired emotional attachment to either the parents or a primary caregiver, lack of emotional attachment, maybe some unmet needs of the child. Well, in a textbook of psychiatric disorders in 2014, it was claimed that this is a learned condition from the behavior of psychologically manipulative parents or peers. Well, is there any anatomic abnormality that's found? People have found some little minor changes, but they probably don't really equate to the underlying condition itself. So people have found some smaller volume of the gray matter and some abnormalities in some of the white matter, and maybe some increase in the reactive oxygen species, free radicals that are formed. Well, the Diagnostic and Statistical Manual, that's the DSM-4, that's published by the American Psychiatric Association, they say that the narcissistic personality disorder manifests a pattern of grandiose behavior. It's in fantasy or in behavior itself, need for admiration, the lack of empathy, tends to begin, as I mentioned, in early childhood. They say you have to have at least 3 symptoms, and they call the symptoms either failure to conform to social norms with respect to either lawful behaviors indicated by maybe performing some illegal activities, maybe arrested, maybe not. People are deceitful, repeated lying, using aliases, or conning other people for pleasure or for personal profit or personal gain. There's impulsivity or failure to plan ahead. And many of these people manifest irritability or aggressiveness. They can become involved in personal fights. Some people are reckless. They have disregard for safety of themselves or other individuals. They're consistently irresponsible. They don't pay their obligations. They don't fulfill their promises. They lack remorse. They seem to be totally indifferent to the suffering of others. Then came the DSM-5. That's the 5th edition. And they changed the diagnosis a little bit. Now, in the Diagnostic and Statistical Manual, the 4th edition, when that came out, the psychiatrists criticized the definition as being really not sufficient to express all of the changes that these individuals had. So then they changed it to the DSM-5 and changed the definition slightly. Now they say it's too unwieldy and too constricting, and it's of limited usefulness. So how do we make the diagnosis? Well, we're kind of at a loss right now for making the diagnosis, because even in the 5th edition, where they define the condition, they said, but we have some alternative models that we should consider, talking about the identity of the individual or the self-direction, the goals that the individual has, or the empathy or lack of it, or the intimacy or lack of it that the person has. Well, they've even gone so far as to differentiate narcissism as grandiose narcissism or vulnerable narcissism. The grandiose narcissism, the one that you hear so much about, that has the overt grandiosity and the aggression and the boldness and the extroversion and the sense of being entitled and seeking power from the status and the lack of empathy of individuals. These people tend to be thick-skinned and manipulative and disagreeable. They take risks. They seek attention. They're aggressive and they're outspoken, as opposed to the vulnerable narcissists. These individuals have a diagnosis that's frequently overlooked. They're hypersensitive in their defensiveness. These individuals tend to be depressed or thin-skinned or shy or anxious. Now, not everybody who has narcissism is successful. Some people with narcissism or the narcissistic personality disorder actually refuse to take risks because they don't want to fail. The shared tendency of the grandiose narcissist and the vulnerable narcissist, well, they're all egocentric and they're demanding and domineering in their interpersonal styles, and they tend to be antagonistic and arrogant. Well, there was a psychologist, Theodore Millon, and he broke down the narcissistic personality disorder into several subcategories. And they're particularly useful, I think. Now, they're not recognized by the World Health Organization in the International Classification of Diseases or the American Psychiatric Association in the Diagnostic and Statistical Manual, but he talks about unprincipled narcissists. These are the con artists and the charlatans. These are people who are unscrupulous and domineering and amoral. These are people who are disloyal and fraudulent and deceptive and arrogant and vindictive. These people exploit other individuals. Then we have the amorous narcissist. These are people who are sexually seductive and enticing and beguiling. They tend to be glib and clever. They're disinclined to real intimacy. They often have frequent affairs, typically with exotic partners, like perhaps a Playboy model or an adult film star, pathologic lying, swindling. There are several other subcategories of narcissistic personality disorder, but overall, the symptoms are that these individuals tend to have fragile ego. They're intolerant of criticism. They tend to belittle other individuals. They take great pride in the accomplishment of the family and the children. And they can write off friends at a moment's notice, either because of a real or perceived slight, or they don't need them anymore for anything. These individuals tend to be impatient, especially when they're angry, when they don't receive their special attention. They easily feel slighted. They react with rage and contempt. They try to belittle others. By doing so, they make themselves seem to be superior. They have difficulty relating to the emotions and the behavior of individuals. Major problems in dealing with stress and adapting to change. These people, interestingly, can feel depressed because they fall short of perfection. They tend to have some secret feelings of insecurity and shame and even vulnerability. According to the Mayo Clinic, these people insist on having the best of everything, the best car, the best office. They take advantage of others to get what they want. They monopolize the conversation. They tend to belittle individuals and look down on other individuals. They tend to be preoccupied with fantasies about their own brilliance and power and beauty. Leads to problems in marriage and in their working with other individuals. They can be high performers, but they're stung by criticism. And they react with anger and disdain. They become socially withdrawn at times. They become isolated. They find that they don't really have any friends. They have difficult time forming deep relationships. Now, the symptoms they go on, and it's a long list of problems that these individuals have. Some of them come out looking like tough guys, and they look intimidating, they look like they're scaring other individuals. Other people come out as the nice guy. Some people come out as the corporate type, diplomat. But they really don't seem to care, even though they appear to care about other individuals. Some people are the comedians, life of the party. Some people are success-oriented, and they're your best friend. Until you can't provide anything else for them, then they cut you off. Well, this condition may be associated with a variety of other psychiatric abnormalities. So when a person has one psychiatric disturbance, then there are frequently others that follow along with it. Now, the question really is, does the person have multiple psychiatric abnormalities, or is this really included in the one that we really have failed by our definition to include? But anyway, so when we talk about people who have the narcissistic personality disorder, they frequently use substances. Cocaine is a popular substance, or they suffer from mania or depression or anxiety or obsessive compulsive disorder. Some are bipolar or suffer from anorexia. And the personality disorders in that cluster B all tend to be interrelated, so it's not uncommon to find a person who has or suffers from narcissism also suffers from the antisocial personality disorder, or borderline personality disorder, or histrionic personality disorder, dealing with family. Some of the family members become anxious and have a sense of foreboding and depression or anger or frustration or fear or bewilderment when they have to interact with these individuals. We make the diagnosis either by a questionnaire, but that's not a very good way to make the diagnosis. It's best in an interview situation. But remember, the diagnosis tends not to be easy to make unless a person is manifesting flagrant symptoms. Well, the treatment, it's not well studied at the present time. So if a person suffers from a personality disorder, that's like having blue eyes. And if you have blue eyes, we're not going to be able to change them either with medical therapy or with talk therapy. So do we have good therapies for narcissistic personality disorder? No, but if a person suffers from some of those other conditions, maybe anxiety, maybe depression, maybe they have some impulse control disorders, then we have some potential therapies with our antidepressants and antipsychotics, and some of the anticonvulsant medicines might help. Now, some people have said that Donald Trump suffers from narcissism, but Dr. Henry Friedman, he's from the Harvard Medical School, writing in the New York Times, he said that Trump is so far beyond what could be called ordinary narcissism that it requires a special category beyond narcissism to make the diagnosis. And that might be malignant narcissism, if such a thing exists. So malignant narcissism is a cauldron where we combine a little bit of the narcissistic personality disorder and the antisocial personality disorder and some paranoia and some sadism. It's first identified in 1964, Erich Fromm, a book, The Heart of Man, Its Genius for Good and Evil, further by Kernberg, who wrote in 1975 and 1984, increases with age. Individuals become more isolated, more frightened as they get older. Well, malignant narcissism worsens in every possible way. Once the individual achieves ultimate power, they become more grandiose and more paranoid, more aggressive and more demanding. They're progressively less in touch with reality. They have episodes of narcissistic rage and features of paranoia. They interpret the actions and intentions of others incorrectly. They have abundance of aggression. They have cold-hearted sadistic cruelty, willingness to dominate others, sadistic without expressing any anxiety or any fear. So again, as with the narcissistic personality disorder, malignant narcissism has no direct tool for clinical assessment, no clinical interventions, unfortunately, at the present time, no psychometric tests. Certainly, we don't diagnose it by asking a person to identify an elephant, a picture of an elephant, or to repeat person, woman, man, camera, TV. That's not how we make this diagnosis. People with malignant narcissism suffer from paranoia, as in worries about the deep state or conspiracies or phone taping, and sadism, humiliation of appointees, his generals are a bunch of dopes and babies, talking about Sessions being weak, telling him he's weak. And the narcissism, well, saying the Jewish people in Israel love him like he's the king of Israel, the second coming, that he's a very stable genius. Nobody knows more about taxes or the IRS or ISIS or construction. I don't take responsibility at all. Rates the results of his response to the pandemic as a 10. After all, I alone can fix it. Praise from the cabinet members rather than briefings. Uses the most colorful vocabulary of a third grader or a fourth grader. Went to the very best schools, if he attended. Talks about how, well, most people don't know. Well, that might be malignant narcissism. Or that might be a combination of the conditions that I just mentioned. And by the way, we have a show on the Antisocial Personality Disorder. But anyway, that's malignant narcissism and its sinister variant, malignant narcissism. Some people believe that there might be that individual in Washington who suffers from the condition, and 27 mental health professionals wrote about the disorder and the problem it poses for the United States. They wrote it in a book called The Dangerous Case of Donald Trump. It was edited by the forensic psychiatrist, Dr. Bandy Lee of Yale University School of Medicine. And then there's Dr. Mary Trump, his niece, who wrote Too Much and Never Enough, How My Family Created the World's Most Dangerous Man. And remember, when we talk about malignant narcissism, we combine narcissism with some antisocial personality disorder and some paranoia and from sadism. Well, I'm not making any diagnosis personally, but I urge you to look at the clinical features of these disorders. Make your own determination. And remember, the decisions an individual makes when you're disappointed with how the government is reacting, remember that people who have these kind of conditions, when they make their decisions, when they make their judgments, they're making them with the disease. So you wouldn't expect a normal, rational decision so often. You have to expect that the kind of things that are done, well, they're just colored by this particular condition, at least if you suffer from it. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.